Um, I'm getting a little bit of feedback right now, so I'm going to turn this down a bit. Uh, but what I would like to do today is um, talk about qualitative methods and 5 qualitative methods that we have at our disposal as researchers. The 5 methods that we're going to discuss just very briefly today include elite interviewing, participant observation, archival research, the single case study, and comparative case studies. Um, the first before we move into the individual methods, though, one thing I always sort of chafe at the description of quantitative and qualitative methods, and in fact, you may have noticed that I'll refer to quantitative as empirical methods, and there's this sort of quality. Doesn't all research have quality? And the answer is yes. And so, what distinguishes empirical research from qualitative research? I also don't really like this distinction you'll sometimes hear between hard research, meaning empirical research, and soft research, meaning qualitative research. And so I avoid that entirely. But empirical research basically means that the units of analysis can be measured. The causal factors can be measured as well, and you can then design some sort of empirical causal model, whether it's a likelihood model, a probability model, a bivariate regression model. There are any number of ways in which you can be looking at even simple correlations are in fact themselves the result of 2 empirical measurements, and you can't have a correlation without 2 empirical measurements. It entails systematic evidence collection, and you might think of it as being like a crime scene investigator. You can really dig for the details and codify nearly everything. I'll strain my analogy in a moment. In qualitative research, the responses or units of analysis can be described and sometimes even given a typology, and sometimes they can be treated categorically across a variety of categories. Sometimes the causal factors can be identified and described, but not necessarily measured. And so once again, we may understand how or why something happens, but it may not lend itself to precise empirical measurement. Like empirical research, though, I would argue that qualitative research entails systematic and recorded evidence collection. And recorded means that you actually understand how you came to have the evidence you have, that you kept a record of your collection method. Much like an archaeologist would keep a record of how, where at what depth in the trenches are different matters unearthed, or different artifacts from 300 years ago unearthed. What does that look like? But nevertheless, qualitative research is, I would say, more like James Garner and the Rockford Files. There's always a little bit of uncertainty in both the empirical and qualitative research we do, and we learn to live with that. And really, one way to think about qualitative research is qualifying research. How much evidence do you need before you can make a responsible inference and a defensible inference? Okay, so the first thing we have that is often, and it's very prevalent in healthcare, would be called elite interviewing. And the elite, it doesn't mean that this is like the 1% of the presidential campaign, the top income earners. Elite refers simply to criteria that qualify respondents for a study. So, for example, in my dissertation, I interviewed 130 state legislators about Medicaid, and so they were elite. Not some of the legislators, for example, in Mississippi and New Mexico, made as little as $3,000 or $4,000 a year as legislators, so they clearly had other lives. But they were elite by virtue of their qualification as a member of the State House of Representatives. You could, if you were interviewing only occupational therapists, the elite criteria then is that you have a certified occupational therapist. Nursing home residents would be an example. Medicaid enrollees in Montana would be example. And then the interviews themselves can be structured, semi-structured, or unstructured. Now, structured simply means that you have the exact same interview schedule. Typically, elite interviews will have at least some open-ended questions. And the mere fact of having open-ended questions does not make the elite interview schedule either semi-structured or unstructured. Because what it means, though, is that you're not going to deviate from respondent to respondent in the order in which you ask the questions and receive the answers. A semi-structured interview is actually my sort of personal favorite, and because it gives you some flexibility. You have a stand, and it also gives you comparability, and those are two things you want. So first of all, a semi-structured interview means that you will make your best effort to ask every respondent the same set of questions, but the order may differ. So, for example, when I did my state legislators, in some states I had members of the healthcare committee, and I would ask them first about matters specific to their state that would engage them, and then move to more general questions about Medicaid later in the interview. If I was interviewing a legislator who had no background in healthcare, I might simply begin with my general questions, or if there was no pending legislation, I might begin with my general questions. Unstructured interviews implies a much more conversational tone, where you really let the respondent have a say in what you're going to talk about and what you're going to exchange information about. The nice thing about semi-structured is it achieves a middle ground, because as long as you have certain common ground questions across respondents, you will have comparability and ability to talk about differences in respondents. If you go with a completely unstructured interview, you may lose the ability to have comparisons across respondents. There are times where that might be appropriate, and there are times where but I think they're few in far between. One thing too about elite interviews is that, unlike survey research, elite interviews will oftentimes include repeated interviews or multiple interviews of the same respondents. You go back to them 2, 3, 4 times to get their feedback on what's going on. I apologize, classes seem to be switching here right now on campus, so it's a little bit noisy. Participant observation. In participant observation, you, as the researcher, are an active member of the community you're studying. So, for example, you might be recording healthcare professionals and their patient interactions within the oncology department of Hackensack University Hospital. You're the operation manager for that department. And so you want to, this means that, you are part of the study itself. This actually requires, just like with elite interviews, that you go ahead and have a systematic and articulated means for gathering evidence. And also you have to decide, are participants going to know that they're part of a study, or that they're not going to know? And there are times where this is made, many times, for example, in studies of preschoolers, it's not important to tell the preschoolers that they're part of the study, but you would have to inform their parents, and you'd have to get their parents' consent for them to be observed. Within a hospital, having a study in which people did not know they were being studied would require a lot of IRB hurdles to protect the interest of the people being studied, including both the healthcare professionals and the patients. But you may not want to tip them off that they're part of a study, because you may want their most natural interactions. And so it's not that it can't be done, it's that it has to be done carefully. Once again, with participant observation, like elite interviews, you're going to be doing systematic recording based on things like the participants, the time, the nature of their illness, and even the outcomes of their illness. And also, you have an added responsibility when you're a participant observer to track and understand your own role in the research. How are you affecting both the outcomes, the actual healthcare outcomes you're observing, as well as the research interpretation? You're intrinsic to the research, and so you want to guard against your own bias towards favorable results. I mean, I think that's or you want to guard against your own bias towards the change you may want to implement. And so there again are ways to do that. I was involved in a participant observation study where the healthcare researchers were actually were training the county level employee, the caseworkers at a county level about a child health initiative. So they were both the trainers and the researchers. In order to guard against that, one of the things we did was we had outside auditors to both collect the surveys and also to observe the training courses themselves to ensure that we weren't sort of nudging people along in favor of where we wanted to go. And so we took several sort of steps as a caution against having our own trainers as also the key researchers in each county. Um, Archival research. Archival research are not limited to formal archives that you would go to a university for. So, for example, Penn State has the National Labor Archives. There are really any historical records, including government and administrative records, corporate or organizational reports, contemporaneous notes, legal depositions, and even obituaries. And I thought I would just sort of pick this last one because I've had students use obituaries both to do a historical profile of the early AIDS epidemic in San Francisco in the 1980s, and they went back and traced the obituaries and who people were connected to, what organizations people were, what community organizations did AIDS victims belong to, where did they live within the city of San Francisco. And so interestingly enough, that was one case. Another student did obituaries from 9/11 in order to do a profile of the New York City fire and police departments. She found that actually there was likely still systemic bias in their hiring because they were disproportionately over 30%, even though less than 5% of New York City is now of Irish descent, over 30% of the firemen were of Irish descent. And she then, evaluated how likely it was that we would have a profile like that if, in fact, the city was actively recruiting from all of its ethnicities in an equally enthusiastic manner. Using archives, again, it can be very useful for social epidemiology, and particularly going back to, we've only had sort of knowledge of viruses for about 45, 50 years. But we've obviously had viruses for many centuries before that. And so archival research can be a great way to go back, literally centuries to understand social epidemiology. Again, I mentioned a student who used the obituaries and understanding social networks to understand AIDS in the 1980s. And that's just one example of it. Okay, the fourth issue is the single case study, which is the observation and analysis. And I emphasize the analysis here that of a single community, healthcare program or policy change. And what we really want is we want to attend to understanding how an intervention, whether it's a healthcare intervention, a policy intervention, an economic intervention, how that has changed us before and after. So an example, of an intervention of a single case study is New Orleans with Hurricane Katrina. Obviously, we had no control over the fact that Hurricane Katrina was going to happen. We also had no control over the fact that it was going to slam into New Orleans and flood the city. Actually, you might argue we had some control over whether it needed to flood the city, but it was clearly the intervention. And we had data about New Orleans prior to Katrina, and then we could specifically identify the data we would most want. And we know that mortality increased in New Orleans for at least 18 months to 4 years beyond Katrina as a result of Katrina. Nevertheless, one of the things with the single case study, even when it's a very compelling case study like New Orleans with Hurricane Katrina, is that it can be hard to disprove. What we would need is cities that didn't get hit. So Savannah not getting hit by Hurricane Matthew, for example. Do we see a steady mortality rate there, and can we compare that to the case of Katrina? There is actually a literature on what happens when cases fail, and there's an article by Chris Aiken and Duncan Snydall called The Single Case Study, I believe, and that was published almost 30 years ago. And it talks about when wars don't occur, as opposed to the case studies where wars do occur. And there's another article by Doug Dion that is called The Necessary and Sufficient Conditions for Causality. And basically, Dion argues that a single case study, if we want to believe that something is necessary, like a natural disaster, for mortality to go up, then we can go out and look for the